Every one of us, whether it's you, whether it's me, we're all part of families. All of us know families have wonderful successes, wonderful loves, but sometimes challenges and difficulties and pain.
I remember she kept writing she was sad. I remember that.
He was in trouble with the police, and that's, you know, that scared me because that's his future.
1 in 5 children in Ontario will have a diagnosable mental health issue.
I was completely different, like depressed and like crying all the time.
I started cutting myself and taking Tylenol.
It was pretty severe, terrible too, so I thought, you know what, something's just not right here.
It was not the way it was supposed to be.
Families have the capacity to organize themselves and with the right supports and expertise be part of their own solutions. This organization has grown tremendously since the year 2000 on a number of levels. We were 60 people, now we're up to 205, 210 staff. It's grown in the diversity of services we offer, moving from child and youth mental health and developmental services into early years services, early intervention services, into autism services, and also had significant expansions that's increased our geography and across Northeast Ontario and to one program at least across all of Northern Ontario. You want a culture that has compassion, has caring, and can apply that expertise.
She's a good friend.
Definitely one of the people that would listen to you.
When I joined this agency in 1989, one of the things that really has kept me here, because I've been here now for a long time, is the agency has done a good job of taking care of the staff.
We very much believe in this organization how we operate as an entity amongst ourselves, amongst staff, amongst managers, supervisors, executive directors, boards, staff, sets a tone about how you want the organization to relate to the people you serve and your community.
When you see us go out into the community and give someone support, we give each other that. We give each other 100%. And you never feel like there isn't an answer. You know, there's always someone that you can turn to, a coworker that will support you and help you out. I feel like I'm part of a family there. You know, we support families. We are a family. The family's grown exponentially. You know, we're over 200 staff now, but it doesn't feel that way. We feel connected, and even though you might get in contact with someone in Bracebridge a couple times a year, you still feel as though they are part of that extended family.
It's very easy to talk about transparency. It's very, very difficult to live transparency.
When I've been hesitant to perhaps be less than transparent, people have felt safe enough to call me on it. And I think that's perhaps what feels good in this organization, is people can take that risk.
I would say that the one thing that certainly this organization does better than any other organization I've been involved with before is to literally live transparency.
And it's safe for the organization to reflect that, because the clients really come to achieve who they want to be, who they need to be. So if you don't do that as individuals, you don't do that as an organization, don't turn around and ask your families and to be doing something different. We need to walk the talk.
We're here to support families, to connect with those people that need help.
It was a big relief to actually understand what was going on, and knowing why I'm feeling that way, it helped a lot to know.
And it's pretty nice to see her now and to see her, walk through the halls of the school, and she's got a big smile on her face.
Travis didn't realize what a great person he is. And so now he's learned to understand who he is and what he has to contribute to this world.
Our job is to work with you and to pull in the resources that you need so that you can meet your goals, whatever your goal is.
He was the kid sitting in the corner who didn't even know you were in the room. And I mean, now he's talking and he's walking and he's going to school and he's interacting with people and he's outgoing.
When you see a family that's faced with that kind of hardship to overcome, and then they just, you know, step right up to the plate and they work with you to make the changes that we all know are possible. You know, they give me the hope for the, you know, the work that I do, the work that all the staff do, as well as for the families who come to us. You know, you just know it can be done, and if everybody's working together, you know, we do great things together.
One of the great assets is the fact that we have a diversity of programs and services that can be brought to bear to assist families.
They can turn to us for so many services. I really don't think that some families realize how much there is out there for them.
We offer them responsiveness, we offer them very high-skilled clinical services, we offer them individualized solutions.
Which I happen to think is leading edge. I think it's leading edge in terms of the research we do, I think it's leading edge in terms of the services that we provide, and I think it's leading edge in terms of the leadership that's provided in this organization.
We might involve more than just one service within the agency. We work very much as a team. So whether you come in and you work just with me, then I'm on your team, or you work with me and some of the other programs.
Specialized difficulties in mental health, developmental issues, autistic issues, receive the specialized understanding and expertise and work with us, and we will support them to find the solutions that allow their developmental trajectories and quality of life to move forward. We recognize that who we are, what we are, is based on our relationship we have with our community partners. We're no more important or no less important than the other community partner, and how we all work together is what the community deserves and what families deserve.
We felt we needed the expertise of an agency that dealt with children. So even though we only do crisis work with adults, we developed a relationship with the agency so that they can come in and help us help the kids.
They diagnose the child, psychiatrists, psychologists. We're working with everybody.
We work closely with their North Community Network of Specialized Care. That's a new initiative that this agency is the lead with the last few years, and it's bringing together the clinical teams in the northern region to network together, to build on best practices as a collective group.
There are a lot of families with which I've worked, especially as behavior communication therapist when I was working in the home. There's a real need for bilingual services. A lot of the children that I've worked with do not speak the English language.
Il y a des parents et des élèves qui parlent très peu l'anglais. Donc on est garanti ici à l'agence d'avoir des services en langue française.
Everybody adds value, and we know how we've evolved and what we've become has really allowed better service, better efficiencies that really make a difference for the families we serve.
To do this job, you got to be a certain kind of person, and I don't think you can learn the skills of doing this job without being a certain kind of person. So already the people that are attracted to this work are people that love working with other people.
Gave us hope for our son. Where there was no future, they gave more.
We're all in it for the same reason. It's almost like you would drop anything to do anything for them.
She helped me with a lot of things. I can't even really explain it.
They don't tell you what to do, but they can help to guide you so that you can get your family back. And that's what happened with us.
That alone, you know, it keeps you going, because it's difficult, it's hard, and it's challenging, but those little glimmers of hope along the way, and then especially when you see someone succeed so much and continue to succeed, even though you're not working with the family anymore, you see them and you see that that's continuing. That just makes everything worthwhile.
Regardless of where we are in life, whether we're a grandparent, whether we're a parent, whether we're a child, whether going into a marriage, it's all about family. That's our history. That's who we are. Family is about connections.